Ankylosing spondylitis (AS) is a type of arthritis that mainly affects the back, by causing inflammation in the spine. Ankylosing spondylitis affects the rib cage and neck stiff and becomes painful. It often starts in people who are in their late teens or 20s. In response to the inflammation, the body produces extra calcium around the bones of the spine. This can make extra bits of bone grow and cause back and neck to be more stiff. Ankylosing spondylitis affects the eyes in up to 40% of cases, leading to episodes of eye inflammation called acute iritis. Acute iritis causes eye pain and increased sensitivity to light, photophobia. Rarely, ankylosing spondylitis can also cause serious complications involving the heart, lungs, and nervous system. In rare cases, some of the bones of the spine may link up or fuse together because of the extra calcium. In serious cases, this can make the spine curve forward more. Although the cause of ankylosing spondylitis is unknown, it is believed to involve a combination of genetic and environmental factors. More than 90% of those affected in the UK have a specific human leukocyte antigen known as the HLA-B27 antigen. The underlying mechanism is believed to be autoimmune or autoinflammatory. Between 0.1% and 1.8% of people are affected. 3. Onset is typically in young adults. 2. Males are more often affected than females. The condition was first fully described in the late 1600s by Bernard Conner, but skeletons with ankylosing spondylitis are found in Egyptian mummies. 8. The word is from Greek ankylos meaning to unite or grow together, spondylos meaning vertebra, and itis meaning inflammation. Ankylosing spondylitis is a form of ongoing joint inflammation, chronic inflammatory arthritis, that primarily affects the spine. This condition is characterized by back pain and stiffness that typically appear in adolescence or early adulthood. Over time, back movement gradually becomes limited as the bones of the spine, vertebrae, fuse together. This progressive bony fusion is called ankylosis. The earliest symptoms of ankylosing spondylitis result from inflammation of the joints between the pelvic bones, the ilia, and the base of the spine, the sacrum. These joints are called sacroiliac joints, and inflammation of these joints is known as sacroiliitis. The inflammation gradually spreads to the joints between the vertebrae, causing a condition called spondylitis. Ankylosing spondylitis can involve other joints as well, including the shoulders, hips, and, less often, the knees. As the disease progresses, it can affect the joints between the spine and ribs, restricting movement of the chest and making it difficult to breathe deeply. People with advanced disease are also more prone to fractures of the vertebrae. Although ankylosing spondylitis can occur in more than one person in a family, it is not a purely genetic disease. Multiple genetic and environmental factors likely play a part in determining the risk of developing this disorder. As a result, inheriting a genetic variation linked with ankylosing spondylitis does not mean that a person will develop the condition, even in families in which more than one family member has the disorder. For example, about 80% of children who inherit HLA-B27 from a parent with ankylosing spondylitis do not develop the disorder. There's no current cure for ankylosing spondylitis, but treatment can manage pain and prevent disability. Proper, timely treatment can help reduce symptoms. It may also slow or even stop possible complications, such as bone deformity. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, are often used to help manage pain and inflammation. They're long-acting drugs and are generally safe with few complications. Corticosteroids are commonly prescribed for the short term. This medication is a powerful inflammation fighter, so it can ease symptoms and slow damage to and around the spine. Tumor necrosis factor, TNF, inhibitors are drugs that can block inflammation triggers in your body. These drugs act to prevent inflammation, and they may ease joint pain and stiffness. TNF inhibitors are typically used after the condition has progressed and NSAIDs are no longer effective. Lastly, in severe cases, your doctor may prescribe disease-modifying anti-rheumatic drugs, MARDs. These drugs work to slow the process of the disease in the body in order to prevent worsening symptoms. For severe damage or deformity in knee or hip joints, a joint replacement surgery may be necessary. Likewise, an osteotomy may be performed on people with poor posture caused by fused bones. During this procedure, a surgeon will cut and realign the bones. Exercise, stretching, acupuncture, healthy diet, posture training, heat and cold therapy are some measures for treatment of ankylosing spondylitis. If ankylosing spondylitis is left untreated, some complications are possible. These include: vertebrae may fuse together because of chronic inflammation. Inflammation can spread to nearby joints, including hips and shoulders. Inflammation may spread to ligaments and tendons, which may make flexibility worse. Eye irritation. Heart, lung, or bowel damage. Compression fractures of the spine. Heart valve. Rarely, as can enlarge your aorta, the largest artery in your body. This can change the shape of your aortic valve, allowing blood to leak back into your heart. Your heart won't pump as well, which can leave. In 2007, a collaborative effort by an international team of researchers in the United Kingdom, Australia, and the United States led to the discovery of two genes that also contribute to the cause of AS, RTS1 and IL-23R. The findings were published in the November 2007 edition of Nature Genetics, a journal that emphasizes research on the genetic basis for common and complex diseases. 45. Together with HLA-B27, these two genes account for roughly 70% of the overall number of cases of the disease.